Hello, good morning, everyone. Before we start on our discussion, I would like to discuss first the topics introduction to toxicology until to photosensitization. I am the one who will be discussing on the following topics. So, and then after the 16 topics, I would like you to report each of you with 6 topics. This is important because this report will is equivalent to 100 point exam. So you should be prepared and also knowledgeable of your report because this will serve as a 100 points or one examination. So as what I have discussed earlier that or a week or 2 weeks earlier that our long exam, we have two long exams, the midterm and the finals. So here, the reporting also may be equivalent for your third long exam, so 100 points. So this is for you to express or to give your knowledge or what is your knowledge in your minor subjects in your until now as 6 year student. So it is better for you to report because in the future you'll be reporting or presenting in a conference so that you will be enhanced no, in your presentation. So after this, next is you also follow the format. So every report is various. The format is various sources, and then absorption and fate, and then mechanism of toxicity, pathogenesis, clinical findings, and pathological lesions. And each report now will ask a question, and then if you can't answer, so your score will be deducted. So I want you to be prepared and also be knowledgeable of your report. So we will only have 6 topics no, in each students, and then in every meetings you will report 3 topics. So at least in your topics you have 2 sessions in your topics. Okay. So after this, so our topic for today is on the factors modifying toxicity. So but before I will start on the lessons, I would like you to have an assignment and read on the toxicodynamics. And the learning objectives for this discussion is at the end of this module that students will have a concise idea of the various factors modifying toxicity in animals. So there are factors modifying the action of a poison. This includes the toxicant-related factors like exposure-related factors, subject-related factors, and environmental factors. Intoxicant-related factors, it comprises of the chemical identity, physical characteristics, vehicle, formation, formulation, and in exposure-related factors, it comprises of the dose, route and site of administration, frequency and duration of exposure, time of exposure, and in subject-related factors, it includes the species, strains or breed, individual differences, age, nutritional status, sex, pregnancy, diseases, and also in environmental factors. It includes the temperature, stress, and ventilation. So in toxicant-related factors, the most important is the physical state. So the physical stage in which a toxicant is presented will have a considerable effect on its absorption and consequently on its intoxication. So if there is a good absorption, and it will have a good also intoxication if the drugs is presented to the animal or the toxicant is presented to the animal. So in general, the greater the solubility of the material, the greater is the extent to which it is observed. So in common sense, so if there is a greater soluble, and then is this the greater of the toxicant to be observed. And then the state of subdivision of a solid materials is also important. Thus, in case of zinc phosphide, the relatively small particles produce rapid death due to liberation of the phosphine, whereas the large particles are associated with delayed death due to hepatotoxicity. So here, the example is the zinc phosphide. So actually, the zinc phosphide can cause toxicity due to liberation of the phosphine gas. And then in this liberation of the phosphine gas goes at the acid pH in the stomach, the gas results in direct GI tract irritation, and then it will go or along with the cardiovascular collapse. So here, if you analyze the zinc phosphide or the phosphine gas with with a small particle, no, undergo does not need to the liver to have an effect for toxicity. Whereas the large particles, no, it may be delayed or delay the death due to hepatotoxicity, no, it will pass to the liver. So another thing is when the material is presented in solution, the nature of the carrier solvent will be important. For example, of this, the absorption oily, from oily, especially vegetable oil solutions, will be greater than that from the aqueous solutions or emulsion of the toxic agents. So it may be explained since as we figure out in our body, most of the hydrophobic have a greater absorption when compared to the aqueous or the aqueous solution. So oily is greater than the aqueous solution, no, most especially. In exposure-related factors, in those, low levels of many toxic agents will have no effect. And then in intermediate and repeated doses may produce either no effect or chronic poisoning. So it will have the body to have no effect to withstand the insult or have a chronic poisoning, no? Withstand the body, but the body has a lesions. And higher levels may be produce either subacute or acute intoxication. Next is prior exposure. So prior exposure of individuals to a non-toxic levels of poison can result in a development of tolerance to its action. So one of the example of this effect is seen with nicotine in smokers. morphine in drugs, addicts, and the anticoagulant warfarin in rats. So the route of exposure, in general, toxic effects are more when a toxic enters through inhalation or intravenous route because it goes directly to the blood and the faster effect. Also same with the inhalation. So the route of entry of poison plays a major role in modifying the toxic effect of the poison. So in animal species, there is a variation among different animal species in response to toxic agent, and it may be influenced by whether the animal is a ruminant or non-ruminant. So in ruminants, there is what we call a longer digestive tract, and then there is a lesser chance of toxicity. So here, the ruminants, the diluting effect of the large bulk of the rumen contents and the ability of the rumen microflora to metabolize foreign compounds will have a protective effect of the ruminants. While in non-ruminants, they have a shorter digestive tract and is more efficient. No? When you have a shorter digestive tract, it is more efficient in absorbing ingested materials. That's why when you correlate it with the toxicity, the shorter digestive tract is more or higher chance of toxicity rather than in ruminants with a longer digestive tract and have a rumen contents which can dilute the toxic agents. And that the anti-cancer drug methotrexate is toxic to human beings, mice, rats, and dogs. But in guinea pigs and rabbits, they do not show toxicity to methotrexate. So actually, methotrexate is formerly known as amethopterine, which is a chemotherapy agents and immune system suppressant. So this is usually treat, used to treat cancer, autoimmune diseases, and ectopic pregnancy and for medical abortions. So here, in this statement, so it varies on different species or animals. So the rabbits are resistant to atropine poisoning because the rabbits have this atrophinesterase which is present in the blood and in some tissues of the rabbits when compared to other domestic animals. And then the rats exhibit toxicity to red squale while dogs are resistant to it. Actually, red squale plant or mainly the bulb of the red squale contains a poisonous substance which is scleroside, which is a highly toxic glycoside or bofadienolide glycoside. So the adverse effect of this poison, it affects the cardiovascular and CNS, causing acute convulsion and death. And usually the rats are more predisposed of this. And there's a study in dogs, they're resistant because the dog has a good ability in smelling and they don't like the smell and they are reluctant to the red squirrel. So they're reluctant. So usually here they don't like the smell of the red squirrel. In sheep are more prone to copper poisoning compared to other domestic animals because sheep are the most susceptible species with this because their liver cells have a high affinity to copper poisoning, and they excrete copper in the bile at a very low rate. Now imagine, no? They excrete the copper into the bile at a very low rate, leading to build up of liver the copper concentration over time. No? It will build up to the liver the copper concentration over time, and this will lead to copper poisoning of the sheep. Also, in general, um, the antioxidant butylated hydroxytoluene and butylated hydroxynisole are potent inducers of epoxy hydrolases in mice compared but not in rats. In general, the rats have a low epoxide hydrolase activity relative to mice and the rabbit. Also, hydroxylation, at least sulfonamides, occurs in human beings and dogs. Some hydroxy metabolites are excreted by the active renal tubular secretion, while others are conjugated with glucuronic acid before excretion. And also cats, no, we all know that cats are highly susceptible to aspirin toxicosis. So this is related to the low glucuronide conjugation. So swine have low sulfotransferase activity and thus a little ability to conjugate the xenobiotics to sulfate. So as we all know that sulfotransferase activity are enzymes which catalyze the transfer of a sulfate group from a donor molecule to an acceptor alcohol or amine. So the acceptors of these are hormones, neurotransmitters, drugs, and xenobiotic compounds. So the size of the animal also, no, have factors in intoxication. No? The amount of material ingested per unit body weight determines whether or not intoxication occurs. No? As you also compared it with our pharmacology, that's why we have computation of drug doses, especially um, on the body weight of the animal. And also individual variations in the contribution made to the total body weight by the digestive tract and its contents and the body fat will also result in differences in response between animals of the same weight exposed to the same quantity of a toxic agent. This here, it could include here the enzymes and other anatomic physiologic variations of different animals. Also, there are marked differences exist among species, strains, and individuals with regards to the amount of body fat and its mobilization. So, according to the mobilization of fat, it can greatly reduce the availability of adipose tissues to serve as a depot for xenobiotics. So, if there is a high mobilization of fat, it will reduce the ability the availability of adipose tissues leading to toxicity. So as we all know, the xenobiotic is a term used to describe chemical substances that are foreign to an animal. So this includes the drugs, pesticides, cosmetics, flavoring, fragrances, food additives, and etc. And for acute exposure, this can increase the amount of xenobiotics in non-adipose tissues, including the brain, as well as the sites of metabolism and excretion. For animals also, for animals with chronically exposed to lipid-soluble, metabolically resistant compounds, mobilization of the body fat can elevate concentration of the xenobiotic increasing the likelihood of toxicosis in the animal or in its developing or nursing offspring. Barbiturates, when administered at body weight basis in large white Yorkshire pigs, induce toxic effects, no, due to the presence or the breed, no, the breed of the large white, but because they have the presence of the large body fat when compared to other breeds of pigs like landrace, Pitain. So they are more have a toxic effects when compared to other domestic animals in barbiturates. And also age-related factors also plays no a role. No? A very young and a very old animals are in general more vulnerable to the toxic agents because of the reason that very young animals are affected because of their poorly developed detoxification systems. They are not yet developed, especially on the liver systems or the detoxification systems. While the very old animals, the problem here, they are most affected because of the poorer state of health because of age-related lesions or age-related problems. No? The organs uh, did not function very well because there is a problem because of the age related, and this will result in a lower metabolic and excretory capacity of the toxic agents. No? So sex in here in sex there is a very little difference between the males and the females in susceptibility to toxicosis. However, in studies, the rat is an exception. For example, the production of malformation in the offspring of females exposed to some period of gestation and the effect produced by oestrogenic agents are also exception to these rules. And of course, in general health, presence of renal, hepatic, or cutaneous lesions and gut stasis influence the susceptibility of toxicosis. So, like just like here in hepatic, no, as we all know that hepatic plays a role in detoxification, and also renal or kidney plays a role in excretion of the toxic agents, and also cutaneous lesions. So the general health plays a major factor also. In nutrition, inadequate quantity, quality of the feed supplied, and the presence of gut parasites. And this gut parasite could be a competitor of the nutrition of the animal, and their consequential nutritional effects could have a marked influence upon an animal response to toxic agents. No? So there's a problem already here in the nutrition. And then if there is a worm or gut parasite, it also compete not for the nutrition. So here, this explains that the health status of the animals, especially also the nutrition, plays also a major effect in toxicosis. In environmental related factors, especially factors such as temperature, humidity, and barometric pressure, affects the rate and composition and even the occurrence of some toxic agents. Many mycotoxins and poison plants are correlated with seasonal or climatic change. One of the examples of this is the ischemic effect of the ergot poisoning They are more often observed during the winter cold, and plant nitrate levels are affected also by rainfall amounts. Air circulation also affects toxicity. So, for example, the silo gases accumulate in confined spaces and settle to low spots. Light also plays a role in modifying toxicity. Some toxicants undergo degradation readily after the exposure of a bright sunlight. So that will end our topic for today. I hope you cope up all the discussions for today. So I want you to prepare for your report. Take the time to make the report. Okay, so thank you.